Alright fam, well it's time to engage. Moods are front and center, enter the stage. Mind, body and spirit to try synergy. Ask not like Kennedy, feel the energy. Jump as you live, try to give all positive vibes. Ignite your cognitive senses. The consensus, moods are stupendous, tremendous, and kicks like Juventus. Always on point, sharp like a knife, cutting through the bull, tame the strife of life. With no type of hype, don't like take a hike or roll the dice, grab the mic, connect like Skype. No need to save face, it's a safe space conducive to mental fitness, wellness inclusive. Chasing nirvana, elusive. Instead, shed the abusive pattern, real like the rings of Saturn. Full circle, Mutai's in purple, royalty regal. She's killing you with kindness, it's almost illegal. So my people, life is up and down like a seesaw. Calito, fly away high like an eagle. Watch the leaves grow. Once my flow is flawless, then it's finito.
Okay. Welcome everybody. We're live here on Shifting Your Mindset with Mutsa. It's 10 p.m. UK time. Shout out to everybody that's tuned in. This is our second visual show today. So I'm super excited. I had a show earlier on with some young girls that left me shifted. So anyway, today I have a guest on the show. For those that are tuning in for the first time, so this is my show this is our show, which is called Shifting Your Mindset with Mutsa. The vision is to inspire people so that we move into positivity, so that we move into a stage where we shift our mindsets, that we absorb more positivity than negativity because we need it. So today I am going to be focusing on a topic that's very, it's a crucial one. It's one of those things where we need to talk about these things. And this is part of the things about my show is I talk about real life experiences, things that are happening within society, things that are happening within the community, positive things. Sorry, it's no, this is strictly positivity, positive vibes only. And I bring in real life guests that bring in real life experiences, and they shift our minds. They leave us at a point where we are inspired, where we feel like, because I always say to myself, life is the greatest teacher. And because life is the greatest teacher, it means we have to bring in all our experiences, to move us into a positive era. And right now we're living in a very dark world where we're seeing a lot of deaths. It's really sad. We're living in a very dark time, and we have COVID, which is something that's new to us. But I actually have a medical expert today, which is part of the things that we do on the show. So I actually have a medical expert today who is going to be on the show, and he is going to give us insight about COVID, because there's a lot of myths, there's a lot of things that are speculated, there's a lot of misinformation. So I thought to myself, we need to do something to beat this pandemic. You know what I mean? We need to take action. If we all come together, we'll be actually able to beat it. So I was fortunate enough to get some time with this man, because he's very busy. I'll let him introduce himself. But he is going to share an insight on what COVID is, what we need to do, the vaccine, because there's a lot of things happening. There's a lot of talks out there about the vaccine, about COVID, myths and facts. We need to get the facts, because we need to get to a point where we beat this disease, and we understand how it functions, and we move back, we restore our lives to be where they are meant to be. Because I know a lot of people, some people have lost their jobs right now, some people have lost their loved ones, which is a very crucial point. We've lost a lot of loved ones, and we need to do something. You know what I mean? My view about how I see COVID is, I always say to myself, if I can do at least one thing, one thing to at least sanitize my hands, or social distancing and all of this, because we need to beat this. I've seen a lot of people dying, in the last couple of months, in the last couple of weeks, and we need to do something. So moving on to the show, I have a man who's going to introduce himself, and he's going to give us a bit of insight on what it is, what's happening, and then we'll then move into the shift. So let me get my guest right here on the show. Hello. How are you?
I'm all right. How are you?
I'm fine. We're live here. We're live on the channel. We're on Facebook as well. So we're broadcasting as well on Diplomatic Radio. So I was just telling people about how COVID just changed our lives, and we need to educate ourselves. We need to do something to beat it. And I thought, I was lucky enough to have a medical expert like yourself. I know you're very busy, but so thank you so much for coming on the show, and hopefully we'll be able to do something to conquer this, because I can't stand being in quarantine, or I can't stand being in isolation anymore with the kids and homeschooling. It's changed our lives. You know what I mean? It's
Yeah.
just absolutely changed our lives. So thank you so much. I will let you introduce yourself, and then we'll move from there.
Okay. So my name is Itai Matumbike. I'm a consultant forensic psychiatrist. I'm also the executive medical director at Northamptonshire Healthcare NHS Foundation Trust, which is a combined mental health and community trust. Yeah, that's who I am basically.
This, you're trying to cut corners. That's not what we do here.
Well, you got to tell me what you want to know.
I'm going to dwell into your medical expertise, but before that, I just want
Yeah.
to know who you are, where you were born,
Mhm.
and then we'll move
Okay.
into the, yeah.
All right, that's fine. So I'll start from the beginning then. So I was born in Zimbabwe. I was born in Mashingo. Um, I was actually born at a mission hospital called Musiso, which is St. Anthony's, which is in the Zaka district. But my family moved around a lot, so we started off living in Escutini. We lived in Gwanda, we lived in Gweru, and then we eventually settled in Harare. So I kind of did most of my growing up in Harare, and I went to one of the local high schools there called Prince Edward. Many people might know it, and yeah, that's a little bit about my childhood. I come from a big family. I've got 8 other siblings. So we're quite a big family. Lots of sibling rivalry and arguments and stuff. But yeah, we all get on. My parents are still alive, bless them, and they still live in Zim. Some of my siblings actually live in Zim. I've got a few who live in the UK, but the majority of my siblings live in Zimbabwe.
Brilliant. Because I always say, you're now part of the Shift family. So welcome to the Shift family. When you come on, become part of the Shift family. So I like to get to know the family members. I like to get to know everybody, and so that's a family tradition. When you come into the family, we need to get to know you, and and from there. So thank you so much for that. So before I just move into your medical expertise, can you just tell me a little brief about your professional background? Have you been a doctor? What it is? Because I just want to give people assurance of who you are. Into COVID, know who you are, and
Yeah, no, absolutely. So I kind of went into med school straight after high school. I studied at the University of Zimbabwe, so it was straight after high school. Went into med school, did 5 years of that, and then we used to call it housemanship then. So I did 1.5 years of housemanship in the central hospitals in Harare. So I started out at Harare Hospital, did neurosurgery there. I did general surgery at Harare Hospital, and then I did internal medicine at Parare Nyatwa. Went back to Harare Hospital, did obs and gynae for about 4 months, and then things were a little bit shaky in Zim. It's got to be said. The economy was going down. It was quite sad in the sense that it was at the peak of the AIDS pandemic, and antiretroviral drugs were not widely available at the time, and it was a failing health system, which if you didn't have money, you were in a lot of trouble, so that's one of the reasons why I moved to the UK. I also wanted to specialize, and when I got to the UK, it took a while for me to get the registration that you need to practice medicine in this country, because what tends to happen is that you have to go through what are called PLAB exams. So you do, and they're a mixture of theory and clinical. And when I did that and I got my PLAB and, I was ready to be registered, it was a little bit of a challenge actually getting a job, because you need to have UK references. So, even though I'd, gotten, really decent housemanship tutors when I was back in Zimbabwe, it was not the same, so I needed to do a clinical attachment. And it's interesting that I wound up doing a clinical attachment in Nottingham, and I sort of settled there and did my specialist training in psychiatry and kind of never left until very recently, obviously, when I got the medical director job in Northampton. So I did, core specialist training in psychiatry, and then I elected to do forensic psychiatry because I thought that the legal aspects were quite a draw for me. So I did that. I worked in one of the high secure hospitals, in England and Wales, called Rampton Hospital. Yes. When I worked there, I also did some kind of prison in-reach as well. I did that for about 3 years. And then I moved to a low secure unit, did about 5 years, at a low secure unit, on an admissions ward, treating patients who had, either been admitted from the community or, were being transferred from the criminal justice system. And it was during that time that I sort of, got into management, initially as as an appraisal lead, and then I became a deputy medical director, and then an opportunity came up for me to do an interim job as the exec medical director at Nottinghamshire. And when a substantive post came out in Northampton, I quite liked the style there. It's an outstanding trust, and the CEO at Northampton, Angela Hillary, she's an inspirational leader, and I wanted to learn from the best. So that's why I got a job there.
Yeah. Wow. It is. This is part of the shift as well, because although we're going to touch on COVID, and that's the reason why I just wanted you to give a little bit of a brief background about yourself, because it's not easy to become a medical doctor in a foreign country, and like you were saying, the references from here and all of that. And so I'm super proud of you. I'm super proud of everything that you've managed to achieve. And what I'm super proud of is now at least we've got one of our own that can give us inside information, back to the hot topic of the century. I mean, COVID came and we all didn't expect it. And there's a lot of things that are talked about, myths, and now we have like the vaccine and everything else, and everybody's just anxious with everything that's happening. So because obviously you have that medical background, as you have explained, I'm pretty much sure that as a medical executive as well, you're pretty much on point with the up-to-date data. You know what's coming in and what's going out. You're on point. So I trust your judgment that today, you complete the Fifth Amendment if you feel like you don't want to take responsibility of certain things. But I'm right here sure that you will be able to help us, because especially the BAME people, because stats show that. And I don't know if this is a fact or whether it's also those things that is like hearsay.
No, it is fact. So yeah,
Black people are more affected with COVID. Is that right?
Yeah, the data does show that. Yeah, the data does show that you've got double the risk of getting it, double the risk of dying from it. And actually, most of the people who work in healthcare who died from COVID in the first wave were actually from a Black and ethnic minority background. So this is a number of factors, really. I think one of them is that there's an overrepresentation of what we call the metabolic syndrome, obesity, diabetes, hypertension, amongst a certain group of people, and they tend to be from a Black and ethnic minority background. And the reason that that's significant is that some of those underlying conditions put you at significant risk. Just looking at the raw data, your chances of dying of COVID, is higher the older you are. So in the over 80s, your risk of death if you contract COVID is significantly higher. For some reason, being male is not very helpful. Particularly, males over 50 from either a Black or Asian background will tend to be more susceptible to COVID and will tend to be more likely to die of it. So there's there are a number of studies which are ongoing, kind of looking at why that is. Certainly, there are a number of confounders. I think it would be unfair to say that there's something specific about pigment which results in you contracting or dying from COVID, but actually from a kind of what are the numbers? It tends to be that.
Right. So it is a fact right? So I've got a fact and hearsay box here, right? So it is
Hmm.
a fact that people of same ethnicity are prone to COVID, right?
Absolutely, absolutely. And that's part of the reason why I'm here.
Yeah,
So to be honest with you, I think this is a matter that's really close to my heart. We've lost loved ones. Those big numbers. 2 million people dead worldwide. 100,000 dead in the United Kingdom alone. Those are not just big numbers anymore. These are people that we know.
sure.
These are friends, their family, their relatives. I mean, last year, one of my close colleagues, almost died in the first wave. He was in ICU for about 2 weeks, and we knew, that he had actually contracted COVID at work. And this was quite, it hits you hard, when it's, people that people that you work with, who are at that significant risk. Recently, some family members passed away, and it's been quite traumatic, for us. We've not been able to travel, to bury them. We've not been able, lots of, funerals taking place on Zoom now, because you can't really, be showing up there and congregating. And you know what we're like, as
Yeah,
people of color. We like to hug. We like to have a wake. We like to, really console each other in times of trouble. And those things have not been accessible to us. And this pandemic has really hit us hard.
it's really,
Um,
and this
yeah.
is and this is part of the reason why I felt like it's part of the shift, and I just thought to myself, I need to do something, because I feel like we sometimes we so it hits home. That's when it hits reality, type of thing. And I think been a lot of hearsay about, oh, COVID won't survive in the heat. COVID won't survive in this, that, and the other. And more people are dying because we are not taking time to understand. Because my perception, the reason why I wanted you to come on the show was really because I feel like there's an urgent, especially if Black people, and I repeat, Black people or people of the BAME ethnicities are prone to getting COVID, right? Whether
Hmm.
you in Africa, whether you are in a place that's really hot, we are at a very, very high risk, okay? And this is why we need to take this really seriously. And this is why we need to understand, because we've seen a lot of our loved ones die, and more are going to die. And I was watching some stats, or I was looking at some data the other day that showed that now the numbers that are dying are within the 30s, young people.
Hmm.
New,
Hmm. Hmm.
the new variants is no longer hitting just the elderly people, it's actually
Yeah.
hitting the younger generation. And I'm in that box, and I'm
Hmm.
thinking to myself, I've got a whole future ahead of me. You know what I mean? So you have just confirmed that we are prone, as Black people, as the BAME ethnicities, we are prone to getting COVID, which is
Hmm.
more reason why we need to be vigilant. This is a more reason why we need to be educated and understand how COVID works. Now,
Yeah.
as a medical aspect, can you please tell us how, okay, a little bit of background. What is this virus? What is it
Okay.
exactly?
Okay. So, COVID is one of the sort of coronaviruses. In fact, the SARS viruses, this is not the first time that we've seen them. They did come, there was an outbreak where they cause a, severe acute respiratory syndrome. About a couple of years ago, there was an outbreak, which was quite a potent outbreak of the virus. And then when they came back, in 2019, it was It was a similar, it was a slightly different strain. And what it does, it enters your body, usually through your nasal passages or through your mouth. And then it affects your respiratory system, which is your breathing system, basically, your lungs, your windpipe. And it causes a severe pneumonia. And I think, often when we have, things like the flu, they tend to affect the kind of upper respiratory tract, your nose and your, your upper airways. But this one, goes, deep into the chest, and it causes a pneumonia when, you have the severe form of it. And that's why it's called a severe acute respiratory syndrome. And literally you are, suffocating because your lungs, get a lot of fluid in them, and you can't breathe. And it is quite a painful, difficult death that people suffer when they contract COVID. So it's a virus, and it uses, some what are called surface proteins to attach to your cells and infect you, basically. And the reason why I try and pay a little bit of attention to the surface proteins, there's a protein called the spike protein, which is the one that it uses, to attach to your cells and get inside your cells and cause that infection and, multiply within your body and cause you to become very unwell. It's this spike protein, which is the one that we target to develop vaccines, basically. So, all the vaccines that are out there, they are in some way targeting, the spike protein, so that, you develop antibodies to the spike protein. And when you do encounter the virus, you're able to fight it with a much more robust immune response.
Right. Okay, so that's so I guess where the next question is, obviously I've heard a lot of things about the new variants, and there's another speculation that keeps coming around the fact that the new variants is hides within the male genital areas and all of that stuff. Is that true? Is that a fact, or is that hearsay?
So it is true that for people recovering, from COVID, they've tested various body fluids, and they did find it, in semen. I must hasten to say that for you to contract COVID, you have to be at close quarters. So if you are within 2 meters of someone, the droplets from coughing and breathing, etc., will be the ones that sort of get into your respiratory tract or your airways and cause you to become infected. So if you are engaged in any form of sexual activity, you're already within the kind of 6 feet distance. So your body fluids are making contact, and you can easily contract it that way. So there aren't any studies to actually sort of zone in on is it a sexually transmitted infection. It's a very naughty question you've asked there, Musa. But nevertheless,
it is fact, and that's the reality. And the reason these type of shows like at 10 p.m. or late at night UK time is because I know the kids are nowhere near in the scene, and we need to address these things because there is a lot of these things that are happening, and whether it means we have to abstinence or all those things, it's an unfiltered discussion, and I want to address rumors that
absolutely.
are going around to protect people. Do you know what I mean? So as naughty, it is reality because you can spread it through that way. That's
Yeah.
facts, right?
Yeah. So you can like I said, if you're engaged in sexual activity, you're within the 6 feet.
The
You're breathing, the other body fluids. So remember, with COVID, because it's transmitted by droplets from your airways. So whatever you touch, if there's if there are respiratory droplets on your skin, for instance, if you touch that and then that somehow makes it into your face, then you are likely to contract COVID that way. So it's I don't think there've been any studies out there where they've controlled for certain
Right.
aspects of intimacy and seen that it's transmission just through the sexual fluids.
Yeah. So okay. So we'll back that. So yeah, because this was the common theme last week. I had different people. We have another question about PCR
Yeah,
test. There.
yeah.
Do you want to ask that question since you're
Uh,
the expert?
so it's about what? About PCR tests?
Yes, that they've
Yeah, yeah,
been
go on.
unreal. They've been proven to be unreliable. E.g. in Portugal. What's your opinion on that?
I so the thing about the PCR tests, they're actually testing for the kind of genetic code of the virus itself. Now, where you've got a situation where you're testing for for the genetic code, you've got really good odds in terms of efficiency of finding the actual virus itself. It's important for us to realize that, over the past few months, there have been numerous new strains of the virus, and the genetic code, code that we knew of the virus, the COVID-19, let's call it strain one, SARS-CoV-2, the one that we knew of that, the genetic code with the new variant will have changed a little bit. So it stands to reason that there might be the tests that were the kits for for the old variant of COVID-19 may not be able to pick up the new variant of COVID-19. It's also important to realize that for all tests, all laboratory tests, they have got some, they're not 100% foolproof. So you can get some false negatives and you can get some false positives. Not everything is absolutely 100%. So there might be a chance that the tests themselves may not pick up real infection when it occurs.
Right.
Then there are other things to take into account, that there are times when you're shedding the virus, and there are times when you're not shedding a lot of virus. And if a sample is taken at peak, when you're shedding at peak, then the chances of it being positive is higher than when you're not shedding the virus at a certain time. And you may be in a kind of recovery stage of the infection. That doesn't mean that you haven't suffered from COVID. And similarly, you might test negative, yet you've already you've actually probably have the virus itself, and you've recovered from it.
Right.
Truth of the matter is, if we look at the people who get infected with COVID, the numbers that develop the severe disease are still a minority, and that's important to remember. So people who will come in contact with the virus, some people may not develop the extreme forms of the illness, and some people may not know that they have had COVID, because one, they might not have suffered the symptoms. Two, they might have suffered mild symptoms, felt a little bit under the weather for a couple of days and recovered. But meanwhile, those people may have been asymptomatic carriers, and they've been spreading, the infection to people who might become more susceptible to the severe form of the disease. And that, can be quite tragic, when, people sort of pass the condition to family members. And that's why it's important for all of us to, really remember, to maintain that social distancing, to maintain that, uh, you know.
Right. So, whilst you're talking about that, and then the tests, not being reliable, etc., there's been a lot of conspiracy theories around the virus. There's been a conspiracy theories about the fact that you've mentioned that the BAME ethnicities are more vulnerable, are more prone to the virus. Why is it just us? You've explained the facts and all of that, and there've been a lot of conspiracy theories around it. How do we address these theories? Because I feel like sometimes that's one of the things, because some people say, oh, it doesn't exist, or it's all in our heads, or it's political. They want to do something. They want to depopulate the world.
Mhm.
This virus, they're trying to kill us. What are your thoughts about that? How
Okay. So, so, my first response to your question about, is it real? 2 million people dead globally. 100,000 people dead in the United Kingdom. Lots of people battling for their lives in ICU. We're getting up to about 30,000 inpatients, in our NHS hospitals alone. So it is real. So you better believe it. It's out there, and you better believe that it's out there killing people as well. Like I said to you earlier, I've lost family to this deadly virus. I don't want to take any chances with it. And the important thing to remember as well in terms of the demographics, it's killing both, white people and black people. So, no one's spared from this. It doesn't matter what color you are. Even though, because of our ethnicity, we are sort of more prone to, to getting the virus. It's indiscriminate. Anyone can get COVID. And I try and focus on, we've got a public health emergency. What are we going to do about it? The investigations about what are the origins of it. We leave that to the WHO, public health investigation team that's in Wuhan at the moment, sort of trying to find out how this outbreak actually started. And then maybe we'll be able to get some answers. Where did it come from? And I would say, before we sort of start, running away with ourselves with lots of conspiracy theories, I think we need to sort of look for trusted sources of information and use those, to inform our kind of understanding of this virus. And what I would say as well, is there's a lot of death out there. There's a lot of mistrust. There's been a lot of things where people of color have been disadvantaged in some way. They were in the 70s, the Tuskegee trials where black people were experimented on without their consent. And it stands to reason why people of color will be skeptical. It stands to reason why people will be fearful. What's
Definitely.
important for us, is to really understand, why people are skeptical about certain things. and then respond to what it is, that concerns them the most. And also signposting comes into this. We've got some trusted sources of information, the www.gov.uk, website is a really, really good resource. You'll find everything there from, patient information leaflets about the different vaccines, the ones that are approved for use in the UK. You'll find, general information about how does the infection spread, etc. And all of that, will help you make an informed decision about, what you're going to do to protect yourself and protect your family. And at the same time, whenever there's fear, whenever there's lots of death, people, become suspicious, and people start to spread rumors. And a little bit of, information and a lot of emotive can, be a perfect storm for misinformation and conspiracy theories. And, some people will try and draw attention to themselves, by taking to social media and saying, a whole bunch of stuff, scaremongering, and that can be really dangerous because some of the choices that people make based on some of that information, can be to the detriment of their own health, can be to the detriment of, the health of the people around them. And that's quite risky.
Definitely. So we've got another question from CPK Records. Shout out CPK Records. I'm not surprised he's coming up with these questions. So he's saying, can you read it, Itai? Do you want me to?
Yeah, it says the inventor of PCR never said was designed to detect infectious diseases. So why do we use the data from these tests, as the facts on lockdown decisions? When you develop a technology, the polymerase chain reaction test, is really for, being able to sequence, genetic code and sort of find out what is in genetic code and identify, different genetic codes. So it is in fact used as a gold standard for, identifying different genes. And what better thing, than to identify the genetic code, of anything, like whether it's a virus, whether it's a bacterium, etc., etc. And the applications, for one thing, if you invent something for one specific thing, doesn't mean that somebody can't come and use that that knowledge and that technology for another application. I think when we are thinking about how do we tackle a pandemic which is impacting on our lives in so many different ways, we need to use every resource that we can in our locker to try and fight it. So if it's the science, we need to mobilize that. In fact, when they started developing the vaccine, there were about 160 candidate vaccines, and many different parts of the world set about doing the research to try and develop different vaccines. So we need to mobilize financial resources. We need to mobilize a number of different things. We all need to come together, with one common aim, which is the survival of the human race. So I try not to get too into the politics about the lockdown, but just to offer my tuppence worth. Certainly, if we look at the reducing infection rate over the past couple of weeks, I think it stands to reason that us having to maintain some strict lockdown conditions, has had some impact on our ability to reduce the rates of transmission. So I like anyone else, you know, I'm very definitely supportive of us reducing, you know, our movement.
Yeah. Okay.
Musa,
So
I'd lost you for a minute. You had a bit of
no,
a blank
no.
screen.
Yeah. I'm here. I'm not backstage. Don't worry. I'm not going to leave you out on your own. We're in this together. So you mentioned the vaccine, and I think this is something really, really crucial we need to talk about, because again, I feel like there's a lot of anxiety, a lot of fear around the vaccine, and people are not sure. And you can understand where people are coming from, because everything is happening so fast. Do you know what I mean? And
Yeah.
we've had. So I'll take a quick break. When we
Okay.
come back, I want to focus on the vaccine, right?
Okay.
Because
Yep.
I've heard things about there's going to be a vaccine passport. You can't travel if you don't have the vaccine. The vaccine is there to eradicate us. The vaccine is mark of the beast. The vaccine is this, that, and the other. There's so much going on around the vaccine, and then at the same time, we have a predicament, because we're in a situation where we're trying to save our lives, you know what I mean? And then there's all these things about videos circulating, circulating around, they're trying to kill black people. There's a secret undercover mission that's happening, so be careful about the vaccine. Don't take it. We are at a crossroad, and what is said, what you've just mentioned, one of the most powerful things that you've mentioned right now is the fact that you've labeled us as the human race, right? Which is something we really need to take into account, because it's the human race. It means we have to come together. We have to take a collaborative approach for us to fight this virus, for us to beat this virus. So the vaccine, right? I've got so many questions, and I need answers around the vaccine, the COVID vaccine. Is it pure? Does it exist? Is it real? Is it a conspiracy? What is it? So I'll take a quick break. After the break, I'll then come back, and then you can explain, from a medical perception, as well as your own personal perception.
Okay.
What are your thoughts around the vaccine? What is this vaccine? Because there are different types as well. Well, how do you know? What's happening? Why is it so fast? You know what I mean? The side
Absolutely.
effects of the
No, these
vaccine and all that. So we need to understand.
all those are really important questions, and I think, if you're going to take any medication, you want to be sure that it's effective and that it's safe. So those are pertinent questions, and they need answering.
We need answers. Ita, you're on the spot. We need answers. You're the medical expert. So I'll just put you backstage at the moment, and then we'll come back after the break.
Alright fam, well it's time to engage. Moods are front and center, enter the stage.
Hey, I just want to say thank you. Thank you, thank you, thank you, thank you, thank you, thank you. You are here on Shifting Your Mindset. I'm sending you so much love, so much light, and so much positivity wherever you are. Mutsa.
Mind, body, and spirit to try synergy. Ask not like Kennedy, feel the energy.
We're back, and the vaccine, the COVID vaccine, the most talked about topic right now that is trending. The vaccine, right? What is this COVID vaccine?
Okay, so first thing to say that there are many different COVID vaccines which are out there. Lots of different drug companies have developed their own vaccine. There are also different types. So the three vaccines which are licensed for use in the United Kingdom, and those three vaccines are the Pfizer vaccine, which is something called an mRNA vaccine. Then there's the Oxford vaccine, which is an adenovirus vector. And then there's the Moderna vaccine, which is also an mRNA vaccine. And I'll explain the difference between, an mRNA and an adenovirus, vector vaccine. So I think before I kind of get into the ones that are there for COVID, which are licensed in the UK. I think it's important for me to say that vaccines generally are not a new thing. So they've been around since the 18th century, when Edward Jenner was developing some a vaccine for smallpox, and used the blood of milkmaids who had been exposed to cowpox and were somehow immune to smallpox. And what he did was that he took their blood and he put it into the blood of a young man who hadn't been exposed to either smallpox or cowpox, and found that he was able to become immune to smallpox from that procedure. I must say that was a very dangerous clinical trial, and would never have been allowed to happen in sort of modern medicine now. But that was the kind of development of the science of you develop what are called antibodies, and antibodies are proteins basically that your body produces to fight off infections. So you develop antibodies to fight infections that your body has been exposed to before. So the idea of giving you a vaccine is to give you exposure, or to help you to make what are called antibodies to fight off a specific infection. So there are many different types of vaccines. They can be live ones which are weakened, or they can be like a component of a vaccine, or they can be the genetic code of a protein which is on the surface of the virus. The mRNA vaccines are new technology, and basically they are mRNA is messenger RNA, and it is genetic code, or what you would call sort of the blueprint for making proteins. So everybody talks about DNA. So what actually happens is that our DNA, which is the blueprint, usually gets translated into what's called messenger RNA, and it's the RNA which actually helps to develop the actual proteins. You follow me? Yeah. So the Pfizer vaccine is made up of this messenger RNA, and this messenger RNA is basically genetic code that's used for making the surface protein called the spike protein. Yeah, and it's the spike protein which is usually on the surface of the virus itself. So it's like the ID badge, the thing that that identifies the virus as the virus. What happens is when you when you are given this Pfizer vaccine and this mRNA vaccine, it gets injected into your shoulder, your muscle cells. Oh, by the way, I've had the Pfizer vaccine myself, and I'm still all right. I keep telling people that these gray hairs on my face were there before I had the vaccine, so I haven't mutated or anything like that. That's a joke, by the way. So it's your muscle cells which then produce that spike protein, and then your body says, well, hang on a minute, there's a protein which is foreign, and then it fights off this protein, so it develops those antibodies and destroys it. The mRNA, that genetic code itself is very unstable. It doesn't bind to your own DNA, and it doesn't cause any mutations. It doesn't bind to your own DNA. I repeat, does not bind to your own DNA, does not cause any mutations, and it is destroyed by the body as soon as it's made the spike protein, as is the spike protein. Okay.
Right.
So this has been tested in the clinical trials, and I wouldn't be saying this if, I hadn't seen the research evidence, that underpins what I'm saying right now. When you then see, so now you've built these antibodies, and your immune system has developed a mechanism of destroying the virus. When you do encounter the virus, you've already got the tools in your locker to fight it off. And your chances of getting a full-blown infection, are remarkably reduced. Actually, even, they say that the Pfizer vaccine has a 95% efficacy, which means 95% of the people who do take the Pfizer vaccine, according to the phase 3 clinical trials, having had 2 doses, will have a 95% chance of not actually getting
Okay.
COVID.
Just a question whilst you're there. Whilst you're talking about clinical trials and all of that. So if a common question that usually comes about is, why was it so quick to have this clinical trial, and then everybody else, we're like, come on, let's get it. When we have been fighting for years, HIV, the antivirals, it's a virus. The flu, influenza as well. There hasn't been anything of that sort to say, well, we have the flu jab, but
yeah, we do have the flu jab. Okay.
Yeah.
So let's talk about this. And normally I'm looking at this question. I'm looking at this question.
Put in to the time that was put in to create this vaccine, roll it out to everybody. How quick was that?
No, that was absolutely quick, and it had to be. It had to be quick. So if you think about it, okay.
Yeah.
So you've got this new virus, right?
Yeah.
It's killing people, on a massive scale. Okay. So there has to be a global effort to try and fight this virus. So remember what I said. This is about the survival of the human race, which means that we need to mobilize, all the resources that we've got. So we need to get, all the pharmaceutical companies. We need the governments put in money, for the development of, these vaccines, through a mechanism called COVAX, which is run by WHO. So there was a lot of investment from, central governments into the development of these vaccines. Remember, I said to you that there were about 160 candidate vaccines to begin with. And then came the clinical trials. So what usually happens, in the development of any drug, what usually happens is that you have different phases of clinical trials. And at the end of each phase, there's an analysis of the data. It's then shared with the regulators, and they analyze the data, they ask questions, and then after you've passed phase 1, you then proceed to phase 2, and then from phase 2, you then proceed to phase 3.
Right.
So what happened in this case was that, first of all, remember I said to you earlier that, the SARS viruses or the coronaviruses, there was, in fact, an outbreak, of COVID. That's why COVID-19 is also called SARS-CoV-2. So when there was that initial outbreak of the SARS viruses, there was already research, and I don't know if you've ever heard of an African American young scientist called Dr. Kizzy Corbett, who was involved in the development of the Moderna vaccine. So she's one of the pioneers of this new mRNA technology. Very bright young scientist, very young as well. And by the time that COVID-19 sort of hit, some of that experimentation and development of this new technology of viruses was already in train. So usually what happens whenever drug companies are developing a new drug, for instance. They start with a drug. They develop the chemical, and they test it in the lab, and they see that, well, actually, this chemical does affect, this part of the body, and it works. And then they do, what are called, animal trials, and then they test, and then they start on the clinical trials, where they test, what are called subtherapeutic, which means less than, the treatment doses, to a very small group of people, just to check whether there are any adverse reactions to that drug, right? So those are the early phases of the clinical trials. And then after they've done that, they increase, the number of participants, and they give them, the normal doses, and that's a phase 2 clinical trial. And the idea there is to check for side effects and check for effectiveness. And then after they've done phase 2 of those trials, then they go to phase 3, where there's a larger scale trial, where they're testing it on a larger group of people. So for the COVID, the different phases of the clinical trials were done concurrently. And the data from each phase was made available to the regulators early in order to save time. So usually what happens is that, you have one phase of a clinical trial, you produce the data as a drug company, you send it to the regulator, it gets analyzed, and, it gets tested, and then you can proceed. What happened in this case, people did the trials concurrently at the same time. And then the other thing, in the phase 3 trials, I noticed you mentioned HIV in that. In the phase 3 trials,
there's something that I just want to say there.
Yeah, in the phase 3 trials, right? Normally the challenge is getting volunteers to actually step up and say, I'm offering myself to take part in your study. Because of the level, of concern around COVID, drug companies did not struggle to get people who wanted to take part in the clinical trials. So, for instance, in the Pfizer the phase 3 trial, they had 43,000 people who took part in that trial. In the Oxford one, it was 30,000 odd. In the Moderna one, it was 24,000 odd. So they were, I may have mixed up the Moderna and the Oxford one. Basically, between 24,000 and 30,000, they were large numbers for all of those trials. Actually, to develop, let me see, I think the hepatitis B, vaccine, they only had about 1,000 people taking part in the clinical trial. So there were 40 times as many people in the phase 3 clinical trial for the Pfizer vaccine than they were for the hepatitis B vaccine, which we have been using, for a number of years. Most people who work in healthcare or in the NHS will have been given the hepatitis B jab almost as a condition of their employment to protect them from exposure to that virus. So when we question, we did this very quickly. So is the science robust? Well, actually, the science is very robust because, the numbers speak for themselves. The results of the clinical trials speak for themselves. And, even some of the, adverse reactions that were seen in the clinical trials have been noted, and they've informed the rollout in terms of, if you've got severe allergies, you're excluded from certain vaccines. And that side of things. Yeah, go on.
So, and I guess for me, what it is obviously because you're privy to this information, because that's your area of expertise. Whereas well, I have been doing some research on my own, but it's not easy to prompt yourself to get to understand that. Hence, when you don't have that much information, you then speculate or you make things up on your own. And I guess one of the things that I've just understood very clearly here, right? The difference between COVID, cancer, all of them are just as deadly. But for me, I think the message that you're getting across that's very clear to me is the human race was at stake, because the way COVID is spreading is like you can't even walk on the street safe. Do you know what I mean?
Absolutely.
Whereas
Absolutely.
cancer, it comes gradually and it's not transmitted by being close. It's not transmitted because you live in the same house. And it's same as HIV. It's not transmitted because you're walking down the street and you touch something that somebody that has COVID. So I guess that's why things had to move fast, because the human race was indeed at stake, because of the way you can contract COVID is like, and it was deadly because the variance is changing. And when we talk about the variance, we're talking about how the virus it's adapting, whereas as opposed to the cancer virus or the HIV virus is consistent. You know what type of virus you're dealing with.
And also just on
that though as well, when it comes to these other viruses, from what I understand as well, with regards to cancer, we will put it outside because it's not exactly. I don't know if it's a virus, but as far as I understand,
some cancers are caused by viruses.
Right.
There are some. There's a clear link for instance, cervical cancer is caused by a virus actually.
Right.
I think it's important for us, I wanted to come back to the HIV question.
Okay.
It's important to mention that, there are clinical trials underway looking at developing, a vaccine for HIV and AIDS. Remember the question, remember the response I gave you about, how many volunteers are you getting? In order for you to get a phase 3 clinical trials, because you need certain numbers for your science to be robust. Because HIV is largely treated by some antiretrovirals now, which are able to control the condition. You're not getting the same number of infection rates, and obviously for volunteers of vaccines, it's an odd one.
With it,
it's an odd one because people
there's a lot of stigma.
And people, you're not getting that many volunteers to come up with it. So there are differences in the appetite for people to get involved in those clinical trials, and for you to get sufficient numbers in order for you to demonstrate that the vaccines are effective. And that's one of the factors that leads to certain clinical trials taking the length of time that they do.
Right. And at the same time, as well as from what I understand, when it comes to even the HIV viruses, I've heard of decoded couples where somebody is positive but they leave with somebody that's negative and they never transmit the virus, and now they're moving from the tablets to getting injections. So technology is moving.
Absolutely.
And I guess the urgency of where COVID stands, the reason why the vaccine was created so quick was because we were being wiped out.
Absolutely.
And because is it true then it started with a bat? Somebody ate a bat?
Yeah, that is true. So the COVID virus is something called a zoonosis, which is infections that can be transmitted from animals into human beings.
Right.
I would be because we haven't seen the reports from the WHO investigative team, about the actual origins, of COVID. I wouldn't certainly wouldn't want to speak publicly about, what I think might be the actual origins, because we don't know. I think I'll probably, you might find out before I do, because it will be, public information when it does come out. So yeah, it is true. And I mean, you've heard of, things like swine flu, you've heard of things like bird flu. All of those things are actually viruses which are transmitted from animals, into human beings, and cause infection in human beings as well. So
so the other question for me is, obviously thinking like both me and you are from Zimbabwe, and just thinking of Africa's where we're from. Is the vaccine that's going to be going to Africa, do you know whether it's the same as what everybody else is getting? Because I think that's where the anxiety is, and politically where things stand, like what you were saying, when you left Zim, the medics around was not that stable, it wasn't sufficient. Is there some sort of assurance that everybody is going to get the right vaccine in Africa? Because I guess that's where the anxiety is as well.
Yeah.
And I know you might not be able to speak on behalf of that.
No, I was going to say, I'll start answering that question by saying, first of all, I don't represent drug companies. Two, I don't represent the WHO. And three, I don't represent governments. So that's my kind of opening disclaimer on that question. So here's what I do know. So here's what I do know. So there is a mechanism for making sure, that the COVID vaccine is distributed throughout the world. Remember, this is a global pandemic, and no country is safe before all of us are safe. You can't have free movement between, you can't have air travel until, we have built enough herd immunity throughout the world to curb the transmission of COVID-19. So that's the reason why, mechanisms such as COVAX exist. And COVAX is basically like an insurance policy. So all the kind of wealthy countries put in money into the development of COVID vaccines. The poorer countries put in the proportion of money that, they can afford. And that the guarantee is that, for those wealthier countries to get those vaccines, a certain quota of the vaccines that are produced by the drug companies is distributed to the developing countries. In terms of, has this vaccine already been distributed to Africa? The answer is yes. And you will probably have picked up from the news that South Africa recently got a delivery of 20 million doses of the Pfizer vaccine. It is the same vaccine, that's being injected to people in the United Kingdom and in the States. So there are other countries that have produced vaccines. I can't speak about those vaccines. I'm a practitioner in the United Kingdom. The regulator that I will, whose sort of science I'll vouch for is the MHRA. Because that's where I practice and that's where, I put my trust in. I'm not saying that, vaccines developed in other countries are not effective. Far from it. Actually, the science, the trials actually do show that, the Sputnik, vaccine, for instance, from Russia is a really decent vaccine. The one from China is decent. They are, effective vaccines, where the science is sound and, they're being used to help people. I don't know is the answer about, the situation in Zimbabwe, because, I have heard some unconfirmed reports that they might not have, put in money into into COVAX. And, by the way, These are unconfirmed
Plead the
hearsay.
Fifth Amendment.
So
Let-
and I do not know that
yeah.
that is information that hasn't been officially verified.
Okay.
This is just a hearsay. Like I said, I do not speak for governments.
Yeah.
I'm
Yeah.
apolitical,
Yeah.
and I just tell you like it is.
Like it is. And
Yeah.
I appreciate that loud and clear, and it was quite interesting. But that's another conversation to know that there's actually these people are coming together, because it said, other countries don't have money to put into this fund. But it's another conversation. It's
No,
another.
but actually, the truth of the matter is, the WHO, whose responsibility, it's a United Nations, organization. The WHO's primary responsibility is to make sure, that everyone across the globe is safe from a health perspective. And that's why that's why countries come together and form organs like the UN, and it is really just about protecting the most vulnerable people in the world.
Okay.
We're all in this together. And actually, if you think about it, from an economic point of view, the West is quite heavily dependent on the third world countries, including Africa. You've got vast, natural resources there. There's a lot of trade between, that part of the world and the western part of the world. And the fact that everything is in lockdown is hurting everybody. And it's in the interests of these global governments to make sure that they make the world safe for everyone, because
Definitely.
everyone stands to benefit.
That resonates with me, because there's another, since you're in forensics as well, which means you're a mental health expert as well. And I feel like there's quite a lot of mental health, an increase in mental health issues or problems or illnesses because of being in this pandemic. I mean, people are just fed up, people are exhausted because we're confined, and that's another reason why we need to come together and act fast, because I don't think lockdown is a sustainable approach. If we're to do a forecast, we're all human beings, despite the fact that you could be an introvert, but you even though you're an introvert, you still need people, because we're human beings, you need that contact. And I feel like there's been an increase of that, because being in lockdown, and I can certainly tell you myself, being in lockdown with two boys, and shout out to my boys, because as you can see, they're like silo, they just doing their thing. But and I really, really appreciate how they are, but it's not easy, you know what I mean? It's not easy for a lot of people, and hence the reason why we really need to act fast, because there's quite a lot of things at stake. So you've taken the vaccine. What would be your advice for somebody that hasn't taken the vaccine, who's at the borderline whether to take the vaccine or not? What would be your advice?
Okay, so I've had the vaccine. So I think it's important to be honest about what you feel after you've had the vaccine. And I know you've had the vaccine as well, Mutsa. So some of the stuff I'm about to say, you'll be able to relate. So when I had the vaccine, I had it in my left shoulder, and I felt pain in my shoulder muscle, for a couple of days after I'd had the vaccine. So you will feel that pain. After the second dose, they particularly with the Pfizer vaccine, some people may have between 24 and 48 hours feeling feverish, feeling that kind of general body malaise, and really kind of feeling out of it for that short period of time. Now, the important thing to say is that, that's actually quite reassuring, because that is your body launching an immune response. So when you feel that joint pain, when you feel feverish, that's your body sort of activating, its immune system, the antibodies and the other cells for your kind of body's defense system. And it releases certain chemicals that that make you feel feverish and make you feel a little bit under the weather. So when you have those 24 to 48 hours of feeling that that general body malaise, at the end of it, you feel absolutely fine. It goes, and when it does, you start to you're just back to normal. So it's important to say as well that there will be some people who have experienced extreme allergies. So we're talking about there's something that they call anaphylactic reactions, and an anaphylactic reaction is an extreme reaction to either food or medication. Where you start to feel short of breath, you get swollen on your face and in your airways, and you can't breathe. There have been, some incidents where, people have had, extreme anaphylactic reactions after having the Pfizer vaccine. And usually it's people who are prone to severe allergies anyways. And so the advice generally is that if you've had those severe allergic reactions, you best stay away from the Pfizer vaccine and have the Oxford vaccine instead. So there is something called, polyethylene glycol, which is in the Pfizer vaccine, and that's thought to be the main allergic reaction causing chemical. Oh, by the way, all the sort of components of all the vaccines which are licensed for use in the UK are available on the www.gov.uk website, so you can see them there. So if you are allergic to any of those things, you need to have a conversation with your general practitioner. There'll be some people who will have specific types of medications, which may affect their immune system, and they need to be cautious before they have the vaccine. And it's important for those people to consult their GPs before they actually have the vaccine itself. So there's some people who can't actually have it, but they're a very small minority. The other thing that they say is that obviously, when they did the phase 3 clinical trials, there are certain groups that were excluded from the actual trials. So like pregnant women, women who were breastfeeding, and children under 12. Those were excluded in the actual studies. And because those people were excluded from those studies, the phase 3 clinical trials do not actually have, safety data on those individuals, and that's why the general advice is to avoid having the vaccine if you are in those categories, and that's the only reason. But actually, that advice has changed as the vaccine has been rolled out, because what actually happened is, although when they designed those studies, they had specifically excluded, pregnant women. What actually happened is that some women did actually get pregnant, and they were already part of those clinical trials. And there's a small amount of safety data that shows that actually it did neither them nor their unborn babies any harm. And that's why the advice has changed, that you consult your GP, and if you are if there's compelling rationale, you can actually opt in to have the vaccine, even if you're pregnant or even if you're breastfeeding. It comes down to an individual decision. But I think the take-home message, if you're worried about any of the underlying health conditions that you have, ring your GP. Your GP has got all your, information in terms of your health records, what medication you've been on, etc., etc., and they'll be able to give you the right advice about, either which vaccine to have or, whether or not to have it.
Definitely. Oh wow, it's been amazing. I mean, we've I think you have covered all grounds. So did you get your second dose yet or not? Or you're
Um, so I was one of the lucky people. So because I opted in very, very early.
Mhm.
If you remember, there was a time that when you got your first dose of the vaccine, you were immediately booked for 3 weeks later to have your second dose. So I got my first dose in early December. And by beginning of January, I'd had my second dose. So I got quite lucky because soon after that,
Yeah.
the Joint Committee of Vaccination and Immunization then changed, the intervals to,
So that
to up
everybody
to
can at
12.
least have something. Yeah.
Mm,
So
yeah.
you've had the double dose. You've had the first and the second
Mm,
dose, and you're here and you're still live and kicking.
hmm
We it's quite good to see that. And
Yeah.
since you're a medical expert, is it okay if people have questions, if they can reach out to you? You can give them reassurance if people have
Yeah.
different, not for anything else,
Yeah.
just
Yeah.
specifically for COVID. I mean, because sometimes
Yeah.
people don't want to come out in the open and ask certain questions.
hmm
Sometimes
hmm
people want to do it in private. So is the
Yeah.
door open for
Yeah,
people?
the door is open. It's ajar. One of the things that because you've already got a platform, and
Yeah.
you've got the access to a number of people. People can sort of ask questions through you, and
Okay.
then we can provide
Pick it up from there.
some
Yeah.
pick it up from there. Um, I'm always a little bit cautious about giving out my number uh, on the
I
public.
know, I know.
But you've got the audience, you've got the listenership. People are in touch with you on various things on
Okay.
your
Yeah.
platform.
So,
Let's make use of that, and then let's link up.
all right.
And you can always call me back. You can, if people have questions which they
We'll
have,
come
which
back.
they haven't thought,
Come
that we
back.
can come back. And I think this is a moving feast. So,
It
we've
is.
spent a lot of
It is.
time talking about the phase 3 clinical trials where there were only about, 43,000 people for Pfizer, etc. But actually, in the United Kingdom alone, we've had over 10 million people vaccinated so far. So we're well within what's called the phase 4 observational study.
Yeah.
And I think that should give people reassurance
Storing.
about the safety. So if this thing was, out there, killing people, with 10 million people vaccinated, we would have heard, a massive death toll, of people who've, been exterminated by this vaccine. But actually, it is quite safe. Look at me. I'm one of those 10 million, and
Yeah.
I'm
But
I'm still here.
there's a whole lot of conspiracies, which
Yeah.
I know we're running out of time, because I think the other thing that people were saying is they're making us sterile. That's why they're giving us the vaccine, so that we don't reproduce, so that we don't, because we don't have enough resources to sustain. Because maybe
Okay.
yeah.
Can I tackle that? If we've got a little bit of time, I can tackle that one.
Go ahead.
So there is no evidence at all that the vaccine makes you sterile. And the way the vaccine is designed, it's designed, to make a protein which is the surface protein of the COVID virus itself, which affects, your your upper airways and your chest. It does not have anything to do with your gonads. It does not integrate with your DNA. It does not have any ingredients within it which cause sterilization. Um, the MHRA, which is an independent regulator, would not ever approve a medicinal product, which was part of a covert operation, to reduce the fertility of the population. So I think it's important that I say that. By the way, I do not speak for drug companies. I'm not paid by drug companies. I am just a clinician who works in the NHS, and I see talking on this show, as a kind of public health responsibility. For me to kind of just spread the right message out there. About what's really going on.
I know.
And
because it is a sensitive issue, because
so yeah, absolutely.
it is a sensitive issue, and ultimately the decision lies upon people, because I think there was the notion that we will be forced to have the vaccine. Is that true?
No. So that's definitely not true. So vaccination is a personal choice. At the trust that I work, NHFT, people were given the option to be vaccinated or not. I would always say, and I've said this before, that it is your choice to decide whether or not to have the vaccine. But remember that the choice that you make not only affects you, but it affects other people. So when I talk about it affecting other people, it affects, your family, your children, your colleagues, the people that you work with. If you are in healthcare, it affects your patients as well. And the other thing to remember is that, a certain percentage of our population has to actually have immunity to this virus in order for us, to eradicate it. Now, the less of us are vaccinated, it's impacting on the rest of the population.
Right.
So it's just food for thought. This is not about judgment. This is just about laying it down as it is. That this is the choice that you're making. You can decide for personal reasons, because it's your prerogative, it's your body. You decide whether you're going to accept treatment or not. But when you've got a transmittable infection, which with 2 million people dead across the globe, 100,000 people dead in the United Kingdom. There's lockdown, which is having a huge economic impact on a number of families. People are struggling out there. There's some families who are making some really tough decisions about whether to eat or not. This thing is affecting every aspect of our lives, and it's important for us to just think about, okay, if we have an opportunity here, to save lives, simply by protecting ourselves and protecting those around us, I think we need to think seriously about taking that chance.
We do, and because you've made it public that I have taken the vaccine, and I mean it's
Did you want to keep that a secret?
No. It's fine by me, and I mean, to be honest with you, one of the reasons why I took the vaccine for myself, just to put it out there, was because I need to do something. We need to do something. I mean, if you are in a hospital setting, or if you know somebody that's close to you, I've known people that have been in a coma and they've been revived. And if they really wanted to kill those people, they would have. Do you know what I mean? It was like a matter of
Absolutely.
life and death. I saw it with my own eyes, and I've seen people poorly with COVID and they survive. They come out and they survive. And to me, that was like because I was really adamant in the past to say, I'm not going to take the vaccine. But then because knowledge is power. It's because I didn't take enough time to invest. And this is why I've come here to say, you know what, we need to, it's these are the conversations we need to have in life right now, because COVID is real. COVID is there, and it's not a myth. COVID is real, I've seen it. You work in a hospital. There's no reason why you'd want to come here and justify something that doesn't exist. It is there, and people are dying. And for me, it was a case of I needed to do something. You know what I mean? It's either I sit back, listen to the news, live in fear, or I do something. I needed to do something. If there is a chance, I took that chance, and I say to myself, look, people are dying regardless. I am going to take a chance to do something, which is why we're wearing masks, because essentially, if this didn't exist, we would all walk around with no masks. We'll be breaking lockdown rules. Everybody is sanitizing their hands because they know at the back of their head it's there. So it means it's there. So subconsciously, if you look deep down inside, you put your hand sanitizer, and then you come back and complain to say, oh, it doesn't exist, but you're wearing your mask 24/7 because you're scared. If somebody coughs in front of you, you're like, whoa, 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 don't come near me. But you're trying to say it doesn't exist. You know what I mean? So we need to be logical. And I think these are very, very crucial conversations we need to have as a race. This is not now about whether black, white, rich, poor, because we've seen the elite people dying. We've seen the poor people dying. We've seen kids dying. Like what I was saying, new evidence is showing that people within their 30s now, the new variant is attacking people within their 30s. So we need to come together, because I feel like if we come together, we will all beat this disease or this pandemic. And the sooner we come together, the sooner we get it out of the way. And that's the reason why I took my vaccine, because I thought, let me try and do something. Let me do something tangible. You know what I mean? Me hiding in my house, wearing a mask with hand sanitizer is not. Let me be part of this, and because there's no the and the other thing as well, that's when I realized that, whoa, we need education, because my eldest son, who is 14, shout out VJ, he's amazing. We have conversations. He was really unsettled when the day I went to take my first dose, because he was like, Mom, they're injecting you with COVID. You're going to get COVID, literally. So I went to get my vaccine, and I took a little bit of time because I was sitting there just to make sure I was okay. My phone had 50 missed calls because my son had this fear in his head where he was thinking, that's it. My mom's going to get poorly and whatnot. And it took days for him to actually come to the realization. And like you were saying, I did have the side effects. And for me, because I had done my research, I had the assurance that it's working. Because if you have something come in your body, and it's meant to trigger, it's meant to send a message. So in simplistic terms, because you were talking in the medical side, let me try and say it in a way.
Break it down.
Let me try and say it in a way that I've understood it, and correct me if I'm wrong, in the most simplistic terms, what this vaccine is. So this vaccine comes in, it's got a message, right? So it's like, it's put in to send a message to your body. So when you get sick as a person or whatever, your body the cells communicate, right? Just like you have a fever, just like you have a headache, you have antibodies, you have cells in you that communicate. When you take the paracetamol, If
Mhm.
you know, if we wanted to be eradicated, we could have been eradicated through the paracetamol. So when you take tablets or whatever medication when you're not feeling well,
Uh-huh.
messages are sent into your body to say, like, okay, you're not feeling well, you've taken that, your body knows it, so your body reacts. So this what's in this vaccine is a special message that's coming in to say, hey guys, we have something new here, something
Mhm.
something that doesn't exist, something we don't know of, that's trying to invade our territory.
Mhm.
We need to be awake. So that vaccine goes in, pings, sends a code, and goes. That's it.
Yeah,
It
absolutely.
doesn't. It doesn't
It
do
doesn't
any.
infect you.
It's just a trigger. It's just a trigger of saying your body tells you, oh, just have a headache.
Mhm.
You get something in your body to say, Mutz, I have just have it. Like when you
Mhm.
hear a lot of noise, you start
Yeah,
to get a headache. A
yeah,
message is sent. Now that's
yeah,
the same thing, and that's how I understood it. So when
yeah.
I started to get the side effects, I was like, okay, my body. Good shout out to my antibodies. You've heard the message.
Mhm.
But that doesn't mean that I'm protected 100%, right?
Mhm.
Because
No.
it's a message.
Yeah.
It's still a message. It's not like it's a message that triggers, that gives you a heads up to prepare for
Yeah.
things that are coming. So
Yeah.
that's how I understood it. So I
And
didn't.
that's a really good way of understanding it.
Yeah.
It's like another way of looking at it is looking at it in kind of like a military way of looking at it.
Yeah.
So you've got your soldiers that defend you against external invaders, and your soldiers that defend you against external invaders are your immune system,
Yeah.
right?
Yeah.
Your invaders come in various shapes and sizes. But if you don't know that they are the enemy, you won't be able to fight them.
Yeah. Yeah.
So if you get exposure and some intelligence, let's say some military intelligence, which is the vaccine, that tells you that, well, this is what your enemy looks like. When those enemy soldiers start to come into your body, your soldiers know what they look like. They shoot them down, and that's pretty much how vaccines work. It just kind of builds up a mechanism of recognizing the infection earlier, and shutting it down. So
Definitely.
that's yeah.
Yeah, so thank you so much, Itai. It's been amazing. I
Mhm.
mean, this is one of those, it's like knowledge is power, knowledge is key, and we need this in life. This is part of what shifting your mindset is. We talk about these things,
Mhm.
we want to make sure we're all better, we're all good, we all live in harmony. And this pandemic means the human race, we have to come
Mhm.
together, because together we can fight it, together we will stay safe. So
Mhm.
I'm really humbled to have your time, because I know you're busy being a medical director and everything. But if you hear any news, please let me know, and I can disseminate if there's anything we need to know. And we'll
Yeah.
be keeping an eye on you. We'll be keeping an eye on you. I mean, now I bet people also be keeping an eye on me, because we're both in the same boat.
Yeah.
And this is not a conspiracy, by the way. Me and Itai work in completely different things, but we both stand for the same thing, that we want to do as much as we can to help people. We want to do it as much as in fact, we've never really had a conversation about the vaccine. We've never.
No, it's the
So
first time.
it's the first
Yeah.
time, so it's no conspiracy here. It's no conspiracy here. I mean, I look up personally to Itai as a role model, because he's burned down the barriers that I thought they couldn't be burnt, and those are the conversation we've had.
Mhm.
But we've never discussed much about the vaccine, so we've literally had an unfiltered discussion here, where he didn't know what he kept on asking me, Mutsa, what is it you were going to talk about? Mutsa,
Yeah.
what you were so nervous. So this is it. You've done it. I hope you're still feeling like you're in safe hands. I try my best to reassure you. So thank you so much. I will catch up with you after the show, and if there are any questions, I'll pick them up with you after. Yeah.
Okay. Thank
All
you
right.
so much for inviting me to your show.
All right,
Cheers.
then I'll just take you out, put you in the backstage, and then I'll catch up with you later. Okay.
Cheers.
All right, cheers. So this was Itai, guys, ladies and gentlemen, boys and girls, if you're still up. But yeah, thank you so much. It's been amazing. This is Shifting Your Mindset with Mutsa. You know, it's nothing but positivity. I aspire to inspire people. I aspire to help as much as I can. If it means getting medical experts, if it means bringing in people that can help us, you know, I'll gladly do that. And I hope somebody out there has had the reassurance. If you still, because there is anxiety, and it's inevitable. We're human beings, you know. Whenever there's something new that comes, it's always a strange time. There's always fear. But I am available if you want to talk. And shout out CPK Records. I love you too. I love you too, and I see you. So thank you so much, you know, for tuning in. This is Shifting Your Mindset with Mutsa. I'm back tomorrow, but tomorrow is not actually Shifting Your Mindset. It's the gospel show on Diplomatic Radio, which is the actual radio. So you can tune in if you want to listen to some inspirational gospel story, because I have a real life testimony again. I have a guest on the show who is amazing. He's going to share his journey as well. So but that's a radio show. Like, you have to log in through the radio station. But we are back next Saturday live on the channel. You are going to get, if you missed half of it, it's going to be pre-recorded as well, and you can get an opportunity to look back, listen. COVID is real, guys. We need to stay safe. We need to look out for each other. We need to take care of each other. We need to be there for one another mentally as well. It's killing us, you know. Like I was saying, shout out to my boys. My boys are amazing. 2 shows today. I've had time in between with them. They're in silence, you know. They're trying. Everybody is trying to cope in a way that they can, and I'm so blessed to have them, because they understand the journey that mommy is on at the moment. So shout out to my boys. Shout out. I really love them, and this is for them as well. So stay tuned, you know, lots more to come. Shout out to everybody that's managed to be on the live show today. You know, you're now part of the Shift family. Welcome to the Shift family. Positive vibes, guys. Let's send that light. You know, light will always drive out darkness. We're living in a dark time. We need to be positive. We need to be loved. We need to be light. We need to be loved. Everything. So thank you so much. I'm sending you so much love and light. Mutsa, and have a fab week. If you don't tune into the gospel show tomorrow, have a fab week. And if you need to reach out, I am here. You can reach out, send me a message, whatever it is, wherever, you know, on Facebook, I'm Mutsa Makaka, Instagram, Shifting Your Mindset, or Lucy Loki, Twitter, I'm there as well. Email Mutsas or shiftingyourmindset@gmail.com. So if you need to talk, I am here. Reach out anytime, any day. Sending you so much love and light, Mutsa.